Appreciate it very much. Okay, got it. I just had that sign recording in progress, but welcome to everybody, all our parents and AISD employees. I see that there's quite a few employees and some parents. I'm glad you all were able to join me. We made it in the evening this time to try and capture more of an audience. And I will start with a couple of things, and then from there, if you have questions about those things or other items, you're more than welcome. I see that we do have a couple of people. We have our parent liaison, Melissa Leos, a couple of our principals. I think I see Ms. Mosley, the high school principal, did I see Mr. La Torre earlier? I know Dr. Althoff in the elementary, yeah. And then Sandy Hans, our special programs director. I'm not sure if our Ms. Candelaria, our yard person and safety coordinator also is here. And I'm not sure who else I'm missing, but there's quite a few. So thank you all for joining us as well. In case there's any questions in your domains or any areas. I know mostly we've been dealing with COVID, and the CDC has come out with some new guidelines. We posted them on our website. We've updated our guidelines. We've also have been having clinics. I know we just had one yesterday from UMC. However, I know they ran out, and that was disappointing. We've asked UNC to the University Medical Center to bring extra. They promised us they would come for 2 days in February because they brought a lot, but I guess there was a big demand. And so they're coming back for 2 days in February, I think. I'm not sure, Melissa, if you know, but I think it's the 21st and 22nd. I think it's that Monday and Tuesday, but we'll put that out later as well. And they'll have not only boosters and vaccinations, but they also will have the flu shot. So we've partnered up with them. They've been here pretty much once every month. In CDC guidelines, of course, those have changed, and we have aligned our protocols to match the Center for Disease Control guidelines, which now allows somebody to come back to school after 5 days if they've been either exposed or even if they've been sick, as long as they don't have any symptoms, haven't been taking any coughing reducing medicine, they can come back. And we recommend they follow the CDC guidelines of wearing the mask for days 6 through 10. So they went from 10 to 5 days, mostly from what Dr. Ocarranza told me, because he came to our board meeting last week, that the Omicron variant isn't as strong, and but it is actually more contagious. And so what he's seeing is a lot of hospitalizations. He told us what he's noticing, a lot of hospitalizations from the elderly or older population, very minimal to no pediatric hospitalizations, according to Dr. Ocarranza, and mostly unvaccinated persons in addition to the elderly. But so we have, there's always changes from the CDC, and then we consult with Dr. Ocarranza, and then we follow them here as well. The other thing that I wanted to talk about, and we can answer questions regarding that in a little bit. We recently at our board meeting last week, the one I just mentioned that Dr. Ocarranza was at, was I wanted to tell parents, and we'll be sending messages. We'll be also posting it on our website and on social media, that we have added just this past Wednesday, it was approved to add 2 additional half days on our calendar. So parents, please take note of that. It's going to be April the 6th and April the 20th. So those are going to be like the half day that we're having tomorrow, very similar to that one, where I think they get released like at 12:30. Those will be added to the calendar on April the 6th and April the 20th. So that's in about 3 months. That's coming up, and we'll send a lot of reminders. We do have the parent-teacher conference coming up in March, right? That one's coming up on March 22nd and March 24th. And more than likely, if this surge continues, it will also be virtual, like it was in the fall. Because we just have to take every safety precaution. Of course, if you need to meet with your teacher as a parent, you're welcome to schedule a meeting. Either just contact the school, contact the teacher or the principal. I think they're all here if you need a one-on-one. But during that parent-teacher conference, I think we'll be virtual. And the next thing coming up too is intercession in about 6 weeks. We have the spring intercession where the first week we'll have classes from March the 7th through 11th. And then the second week we'll be closed for spring break for the second week. So yeah, that first week we will have some intercession classes. They're usually for about half a day, sometimes a little bit longer, to help all those students who are either a little bit behind. We do plan to have some other enrichment type classes. Again, it all depends on the availability of the teachers and how many students we can sign up for those intercession classes coming up. But yeah, that second week of the 14th through the 18th will be, the district will be closed for spring break. And as far as I know, this year we're still going to test. The state hasn't said anything about the tests, so we're still on course to actually take the START test, or for the high school, it's the end of course test. The state will have a Zoom meeting on Thursday where they're going to talk to us a little bit about how the test might be changing. And so we're going to tune in to that Zoom meeting on Thursday to see how they might change some of the testing items for students, because they're tinkering with the test right now. And so they haven't told us yet how that's going to change. Those are things going on right now. Those are important events coming up in the next couple of months. I'm not sure if any of the other administrators that are on right now would like to add anything else. Right now, it's been, if you don't, I can tell you, it's been a very challenging year. There's been a lot of students in and out because they've been getting sick or exposed. And so they have to be out. And so it's stressful for the teachers because they get behind and they're coming in and out. Today, when I was at the elementary, one of my teachers was very happy and very excited. One of the teachers there was very happy and very excited because she said for the first time she had her whole class together in a long time. I think since the Christmas break, they were all there. And I think she hadn't seen them all there present in a while. And of course, we've had a lot of teachers out too, and staff too. COVID has not spared anybody. We've had auxiliary staff, paraprofessionals, teachers, administrators, just anybody you can think of out because they've had this Omicron variant. So it's hit us pretty hard, but fortunately, because we've been able to raise the sub rates right now, the lowest sub rate, if I'm not mistaken, I think they make like 110 a day. So we've been able to raise the sub rates. We've created more of, I guess, of a demand for subs. And so we've been able to have more subs come in, go through the orientation and put them in the pipeline to subs so that they can cover classes, because when so many personnel are out, it creates a lot of stress on the campuses and on the departments because they're shorthanded. If you watch the news, you've seen some businesses that had to close because either they're short-staffed or they don't have enough customers. So it's hit everybody. So, but fortunately, we've been able to attract more subs because of our higher sub rates. We've done the same thing for tutors as well. because we have to compete, of course, with our neighboring districts, whether it's Canutillo, Gaston, or EPISD. So yeah, we've been having more and more orientations for substitutes. So that's been a very good sign. Right now, our enrollment for the district is back up to about 825. We last year we were like in the 770s. A lot of pre-K and kinder kids were out because obviously because of the pandemic. But now it's back up to about, the last I heard was about 826. So it changes every day as we get new kids or one or two kids drop, it goes back and forth. But it's climbing back into the right direction again. So that's good. That's really good news. So I'll stop talking. I'm not sure. I know I've been talking for about 10 minutes. I'm not sure if anybody out there has any questions for me or one of the administrators that is on.
So I did want to just remind our community that at this time, anytime that a student is out with COVID, whether they're in isolation or in quarantine, that all three campuses are offering some kind of remote conferencing. We want to encourage our community to use that as much as possible. I know sometimes our kiddos are not feeling well, and we understand that, but if they're feeling well enough to log in and check their assignments, we want to continue to promote and help them as much as we can.
Yes, and that's a great point. Thank you for bringing that up and reminding me. The remote conferencing is something that the state allowed us to do this year. We can, and what that is we can, if your son or daughter is out because they're being quarantined because they've been exposed or isolated because they're actually sick, the state has allowed us to provide for the middle and the high school is 4 hours of synchronous instruction. And for the elementary is 2 hours of synchronous and 2 hours of asynchronous instruction. And that allows us to capture attendance. And we could do that for up to 20 days for a student. So in other words, when they're out, we have personnel at each campus that can, but you have to help us as parents for them to, if they're not too sick, of course, if they're too sick and they need to rest and sleep, well, then that's what they need to do. But if they're able to, maybe if they're in quarantine and they've been exposed and they're not sick, they can log on and there'll be somebody there. Like at the elementary, I think is Ms. Lerma, and the state allows us. The only thing the state doesn't want us to do is they're not allowing for it to be the teacher of record. It has to be somebody else other than their teacher because they don't want the teacher doing the two things simultaneously. So at the elementary, I know we have Ms. Lerma, Ms. Cardona. At the high school, we have Mr. Soto. And then I think at the middle school, there's 4 teachers there that will call, try and get them to log online and try and help them do their work. And at least they won't get further and further behind if they can log in with them. It works out great for the student and for us too. So that's something that the state has allowed us to do. So I encourage you parents that if your child has to be out, to have them a remote conference with their respective school. Do you all have any questions? But thank you for bringing that up, Mr. La Torre, about that or anything else.
Dr. Troncoso, did you mention the parent-teacher conferences will probably be remote? I'm sorry, I'm at a game right now, so I'm listening to you, but trying to be here also. So yes. I don't know if you mentioned that.
Yes. No, and thank you for bringing that up again. I mentioned it, but at the beginning, that on March 22nd and 24th, when we have, that's right after we come back from spring break. When we have those two, it's just not a good idea right now. So to have a lot of people in, and we'll do that remotely, the conferences, just like we did in the fall. Do you all have any questions? Anything I can try and answer for you? Anything else you'd like to talk about? Is like, yeah, and then, yes, I do drink coffee in the afternoon. I know my wife asked me, why is it coffee with the superintendent at 5:30? I drink it all day, so it's not unusual for me.
I think we have Ms. Plasencia, Maria Plasencia or Delgado. I think they may have questions.
Okay.
Hi, Dr. Troncoso. I just had a question about what you said about the 20 days availability for remote learning. Is that 20 consecutive days, or like, will they be, is it okay if they're split up? The reason I ask is because, for example, my son was in quarantine last week and he's in quarantine again this week. So is that like, does that, you know, is he going to be okay? I mean, with the 20 days, or is it just have to be consecutive, or is it just going to be like a total of 20 days that they have available?
No, it's not consecutive. They have, because the state, I think, recognizes, and that's a great question, Ms. Plasencia, that somebody can get either exposed or infected more than once. So yeah, it's any time in the school year, but it not necessarily consecutive. And if a child happens to be, let's say they're exposed or they get sick and they run out of the 20 days and then it happens again. Well, all that'll happen is that it'll still be excused, right? But they won't be able to remote conference. So they'll have to do the work either if they're feeling okay, they can do the work at home, just like when you're absent any other day, and then turn it in when you come back. But the absence can still be excused.
Okay, thank you.
Sure, but that's a great question.
We have someone else wanting to ask a question, I believe. The last name Delgado.
Yes.
Okay.
Good afternoon. I had a question regarding when they come out positive. They're giving us 5 days to quarantine and then go back to school if there's no symptoms for the past 24 hours. Is that correct?
Right. So the first day that either they have symptoms or when they do a collection of, in other words, a test, that's day 0. Then the next day is day 1, 2, 3, 4, 5. So then at that point, what the CDC says, and this is, if you go to the CDC website, that's what we're following. It's what it says up there. You have the opportunity to send them back to school if, it's a big if, right? If they don't have symptoms, right? And this is for a student who is sick, who actually has COVID, right? And who is in isolation. Because when they're quarantined, remember, they've just been exposed. Maybe somebody in the house is sick, but they haven't gotten sick yet. So they have to quarantine because they don't have, perhaps they don't have the vaccine. So when they're in isolation, after the 5 days, you have the opportunity. That doesn't mean you have to send them back, but if they don't have symptoms, they don't have a fever, they don't have a cough, they're not sneezing, and they're not taking anything like NyQuil or something like that to control it. If they feel okay, then CDC says they can come back on day 6, as long as they wear a mask for days 6, 7, 8, 9, and 10. That's what the CDC recommends under those conditions.
Okay, thank you. Now, they don't have to do a negative test for them to go back to school. Is that correct?
That's correct. That's correct. You don't have to do another negative test. And you just reminded me, because everybody is struggling to find these tests. Our Nurse White, has some on back order since, I believe it's like December. And because of shipping, because of the demand, they haven't come in yet. Because before she used to order them and they'd come in like within a week or 2. And she said that she heard that they might be coming, and these are rapid tests, by the way, not the PCR tests. These rapid tests is the ones you get the results in 15 minutes. But those tests, we have them, and those, we get them through a grant. But we're hoping that they come in. She thinks they're gonna come in within the next 2 weeks. Because she says, I think we're next in line for the shipping. But no, you don't need a negative test for that. Because remember, the main thing that the CDC worries about is if a student or an adult, if they're contagious, right? So if you might have it, but if you're not contagious, in other words, you're not coughing, you're not sneezing. And obviously, if you're coughing and sneezing and you're on day 6, then they shouldn't come back to school, right? You should keep them day 6, maybe day 7, maybe all the way to day 10. But if they say, if you don't have symptoms, and then you're not contagious, then it's okay to come back with a mask.
Can I ask a quick
And
follow-up with
without-
that? I'm sorry.
Yeah, go ahead.
On these tests that I guess when we finally receive them, is the intent to provide that testing to the kids, or what are they going to be used for?
Well, we have limited amount of tests, right? So those are tests for any, if a parent wants to test their child, it's only for employees and for students. So before, I don't know if you remember when all this started, we used to get these PCR tests through the health department, and Ms. White used to be able to give those to anybody in the community. Well, now with these rapid tests, it's only for employees and students, but the intent is only to test as necessary. So if Nurse White gets a request, let's say from a parent that I think my son or daughter might be sick, can you test them? And if Ms. White, Nurse White has them, she'll test them. We can't test everybody because we'll run out in a day. So we use them as it's really as she and Ms. Cermeño, the nurse at the elementary, as they see fit. It's usually when they get a request from a parent or from an employee.
Thank you.
Mhm.
We have another question. Cynthia Medina, do you have a question?
Yes, going back to the topic about when the student is out on quarantine, you mentioned about the student doing their work at home. How can we ensure that the teachers are giving the grade for work that was turned in while the student was out because of quarantine?
So when they're out, because they've been exposed and they're in quarantine. So is your student with the at the elementary?
In the middle school.
Okay. So at the middle school, and Mr. La Torres there's 4 teachers who will attempt to remote conference with your student, right? And so if they do the work, those 4, and I know Mr. La Torre, you can probably name who they are, those 4 teachers, then it's up to them to get that work over to the teacher of record, whoever they have on their schedule. For example, like one of them, I think it's Mr. Lewis, Jeffrey Lewis. And so if he is not your child's science teacher, let's say is Mr. Razas, then Mr. Lewis has to make sure that that work that they did that day gets to Mr. Razas. And if there's a question about that, you can always talk to the principal, Mr. La Torre. Mr. La Torre, I don't know if you have anything else to add to that.
Yes, sir. I think Ms. Medina is kind of referring to just ensure that the teachers are grading any materials completed when they're away from school. And I know right now our teachers are really being very lenient in that, because we understand that students are going to be out from anywhere to 5 to maybe 10 days. And so as long as that does get turned in, we will ensure that it gets graded and it's part of the student's overall grade. And if there's any issue with that, please just let me know and we'll make sure that that happens.
His phone is 915-886-6531. You are welcome to call him. And of course, his email, all our emails, first initial like him is j.delatorre@anthonyisd.net. So that's same thing for the principals. For Dr. Altoff is C. Altoff. For Ms. Marquez, the assistant principal at the elementary, is gmarquez@anthonyisd.net. And Ms. Mosley is O. Mosley. And mine is O. Troncoso @anthonyisd.net. So
Okay, I'll definitely reach out. Thank you.
Mhm.
Any other questions? ¿Alguien tiene una pregunta?
So far, really good questions. And keep in mind in this remote conferencing, this is the first time we like do it this way. Last year, it was virtual learning. It was different. So then this year it evolved to, okay, you can do remote conferencing. We do what the state allows us to, right? Some people have asked me, are we going to go back to virtual? I said, well, no. I said, why? I said, because the state won't allow us to. So we can't. But they allowed us this little leeway to do remote conferencing. And it has to be synchronous, can be for 4 hours, but it can't be the same teacher. So if there's something that we can do better as far as like maybe the grades, making sure they're get to the from the person that's doing it to the teacher, or anything else we can improve in the process, please, I welcome the feedback either through me or to the principals to make sure that we're doing it right. We want to make sure that your students are getting the credit that they do while they're out in quarantine, or if they're sick and they're actually in isolation, if they're able to. Because I know we've had some times when our personnel at the campus will call the home, try and remote conference, but then they'll say they're sick and they're asleep. Then in that case, that's of course completely okay. But we do want them to get the credit if they're able to, in fact, do the work that day to the right teacher. Do you all have any other questions? So far, really good questions.
I wanted to ask a question regarding the recent, you mentioned the UMC vaccination. Now, one of the things that I told my wife, and actually, well, Maria Placencia, she's on, we're on together, but I guess the time frame was between 9 and 2. And so one of the things that we were thinking about is, okay, well, maybe our kids can get the first shot or the booster or whatever, but I wasn't sure if there would be an issue because they'd be in class. And so, is there, and I mentioned to her that in previous times in these events, it was maybe up to 5, which allowed, after they were out of school, then it would allow us to go in and get whatever it is. I mean, it was a flu shot, I think, the last time. So we had it up until 5 or 6. And so we didn't have to take them out of school. Is there an option to maybe extend it, or do we have the opportunity to actually take them out for a few minutes so that they can get the shot and then take them back to school?
Absolutely. You can take them out. We'll ask UMC, but we're on, as you know, we're on their timeline. Maybe if they could stay a little bit longer. The problem really hasn't been the length of time. The problem is they haven't brought enough vaccines. They bring a lot of them, but then they're slammed. And this last one, because I was over there in the gym, they ran out, I would say by about 11:30, around, it was before noon when they actually ran out, and they were turning people away. And so I asked them, like what happened, and they didn't bring enough. They brought as many as they thought they were going to have, and they didn't bring enough. So they promised us they would come back in February for 2 days. But to answer your other question, so if they come back and they say we can be there only from 9 to 2, because it's their staff, we just provide the facility to them, then I would totally encourage you to get them out with a parent permission. Of course, they have a parent permission form as early as possible. Like at 9 o'clock, if they're here from 9 to 2, to try and get them there at 9 so that they can get their shot. And of course, we'll let them out. As the process, once they sign up, fill out the forms, and then wait to be called on, they get their shot, and then they have to wait 15 minutes, and then they're released. So that whole process probably takes maybe about half an hour, if they're quick, to maybe about an hour as they're running people through. But absolutely, that would be something that would be excused, because we want as many students vaccinated as possible.
Good afternoon.
Good afternoon. Hello.
I'm sorry. I apologize if someone already asked this. I was on another call. Per the CDC, it says 5-day quarantine period, right? say for example, a child gets to 5 days and they're still showing symptoms. What's the process with the school? Should we as parents contact the school right away and present our situation? It's been 5 days, we're still seeing symptoms. Do we have to, what do we have to do just for like attendance, right? We don't want to have any issues with attendance, or how is that going to be handled?
Right. So yeah, when they're in isolation, quarantine means they've just been exposed, right? You're not sure if they have it, but when they're in their isolation, they're actually sick and they still have symptoms. And it's day 6. We want you to keep them at home.
Okay.
Because we don't want them here with
Correct.
symptoms, right? The CDC says only if they don't have symptoms. So if they have symptoms, we really want you to keep them at home, whether it's day 6, 7, 8, 9, and 10. After that, the CDC says you should, you know.
But is it just a simple phone call to the school? Hey, look, this is
Yes.
what's going on. I mean, nothing.
Correct. The best thing is something, if you can call, but if you can send an email,
Okay.
I think that's better because.
What is that email address? Do you have it on hand,
to-
or is it on the website?
To which school?
What's up?
To which school?
Elementary school in this case.
Okay, you could either send it to, and Dr. Althoff, I don't know if you want to send it to Olisa Hernandez. So I think it would be O Hernandez at anthonyisd.net. B Moncayo, that's the attendance clerk. These are the two ladies up front, which is BMONCOYA Moncayo, CAYA Moncayo at anthonyisd.net.
Okay.
The two administrators are Chris Althoff, which would be C Althoff, CALTHOFF at anthonyisd.net. That is a principal, or the AP, the assistant principal, is Gabby Marquez at GMARQUEZ at anthonyisd.net. So Olisa is the campus secretary. She takes the calls in the front office, and Betsaida, or Betsy, she's the attendance clerk. And she takes those calls for attendance. So if you have time, you can email. If it's something real quick and you're in a hurry to go to work or something, you can just call probably Betsy or Olisa.
Okay, so probably email is probably the best option, just to report, just to get the attendance in order, and we don't have issues with that at some point.
Yes, yeah. And if they have symptoms, we don't want them to come to school.
Okay, got it. Thank you.
Yes, you're welcome.
I know, I guess Mr. Guerrero has a good point, because I recently had to email because my kids were exposed, and not necessarily at school. I mean, this was outside of school. So I mean, I emailed a whole bunch of people. I mean, including some of the ones you mentioned. But maybe if there's like an FAQ or somewhere where we can see, okay, well, who is it that we contact? And I mean, whoever I emailed, they responded, but at first I didn't really know who to contact for something like that.
The person in charge of attendance, I can give you her direct phone. It's Betsy Moncayo. It's 915-886-6522. And her email is bmoncayo, as I said, BMONCAYO at anthonyisd.net. She's the person in charge of attendance. And then she'll run that to one of the administrators. They approve it, and that's it. If they've been, if they're in isolation, they have symptoms and they're sick, yeah, we don't want them to come to school. And so you just contact Betsy at 886-6522 or email her at bmoncayo at anthonyisd.net. Sure, that's for the elementary. In case y'all aren't sure, for the middle school, the attendance clerk is Sarah Moya. So you would email her. Ms. Moya is SMOYA at anthonyisd.net, and her phone at the middle school is 886-6526. That's her direct line. And at the high school, it is Nancy Quintana. It's N Quintana at anthonyisd.net. She's the attendance clerk, and her line is, again, 915-886-6550. That's at the high school. So those are the individuals who track attendance.
Okay, one more question. So if they're in quarantine, do we have to wait the 5 days? Or but let's say that we can get a test and they at maybe the second or third day we get notification that they're negative. Are they allowed to go back, or do we have to continue to be 5 days?
We follow the recommendation of Nurse White. From what I've seen, she sends an official letter with the beginning of the quarantine. So the quarantine is they've been exposed. Maybe somebody in the house has COVID and they're exposed. So that means that at any time they could get COVID. Sometimes it's not in the first, second, third, fourth, or fifth day. They might get it later because they have an exposure. They're not sick yet, but somebody close by is sick. So Nurse White will set the date, for example, from January the 25th to January the 30th. They're under quarantine, and then they can come back on, for example, if it's a school day, right? January the 31st. So she sets that quarantine timeframe with a letter that goes out. And so we have to follow that. And usually it's for those 5 days when they're quarantined. So not before. Now, if they get sick later, then they'll have to go into isolation. Because we have had several kids that are in quarantine. They're in quarantine, and then at some point, because somebody is close by sick, they'll switch over to isolation because then they got sick. And that's why even if you're in quarantine or you're off quarantine recently because somebody in the home, you have to always monitor your symptoms, because it doesn't generally kick in right away. It takes anywhere from about 3 to 4 days to incubate. So you won't feel anything for about 3 days. It'll take a little while before you start feeling something. And sometimes that's a mistake. Sometimes they think, oh, my brother is sick, and so let me go test. And so Nurse White, what I've learned from her is it's too early to test. You're going to get a negative, but you have to wait about 3-4 days to test until to see if it actually, if it incubated in you, the virus. So, but from what I've seen, those dates that are set from the quarantine, to answer your original question, is for the 5 full days. So they have to wait for those 5 days until they're off the quarantine. And Nurse White will put the date in a letter so you know exactly when they can come back.
Thank you.
Sure. Those are great questions, by the way.
Anyone else have a question? Any final announcements, Dr. Troncoso?
No, final announcements. No, not really. I'm not sure if you want to. I know a lot of the questions are regarding COVID. I know it's hard right now to get a test. You go out there and you see these long lines. And on the testing kits, if you happen to get one, I know a lot of the pharmacies and stores are out. Like you go to Walgreens, they're out. But if you happen to get one, or I don't know if they're going to come in the mail, because a lot of people now have been able to go to that, some government website where you can order your 4 at-home COVID tests. Those Nurse White will not accept because they're not attached to your name. So when somebody brings that, it's just a negative, and they show you a negative. She doesn't know it's your negative or somebody else's negative or the positive. So you can ask Nurse White if you want to do the test there in front of her, but she has to have something that has your name attached to it. And that's usually through one of these testing sites where you get that email from the health department that it has your name. And usually it checks for 3 things. I think the 2 COVID strains and then the flu. And then you'll see negative, 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 or negative, positive, negative. But yeah, those she's not counting those home tests for that reason, because we can't verify that it was in fact yours.
Okay. Then if we don't have any more questions, we can end this meeting.
Well, yeah, and before we end it, Melissa,
Mhm.
I can't emphasize enough to the parents of, how much we appreciate them for everything they do in trying to keep their kids safe. Without knowing what your beliefs are or anything like that, I really do encourage you to have your children, of course, now it's 5 and up, right? Or over 5, to get vaccinated, because from what Dr. Ocarranza has seen, because even though I know y'all probably know, he has a clinic around here, but he also has a lot of patients in different hospitals, because he told me that he goes and he monitors that, as he's a local health authority that's appointed by the health department. And he says that what he's seeing, the people on ventilators, the people that are very sick, are unvaccinated persons, because they don't have that strong immune system. And of course, they have underlying conditions, whether it's heart disease, obesity, diabetes, a whole bunch of other things, any respiratory illnesses. So those are our most vulnerable populations. And that's your grandparents sometimes that are in the home, or older parents that are in the home. So we have to it always comes down to the basics, which is we've had several people that have had family members in their house and they haven't gotten COVID. And it comes down to, you have to not touch your face. You have to wash your hands a lot. And when somebody's coughing and sneezing, they have to be isolated. They have to be wearing a mask, and you have to be wearing a mask, because that thing is airborne. That's one of the things that they have found. More than it won't sit on the desk or somewhere. It's airborne. So that's why the mask is important, because it prevents that as a person is contagious in those 3-4 days, whenever that they're most contagious, and they're coughing and sneezing. And the CDC says it's about 6 feet. So we've had many people that haven't gotten sick just because they've stayed away, they've worn their mask, they washed their hands, and they have refrained from touching their face. So it always comes down to that. So I can't emphasize enough, if you emphasize that with your children, who are here in our schools. We've done as much as we can. I think if there's something else, we'll do it too. Most recently, we installed touchless water fountains, because we didn't want, the kids. So those are now that if you have like a water bottle and that's the one you have, they have those really, and those are actually really expensive to install, but we put them in everywhere. So now they can get water in their bottle. They don't have to touch anything. And we also invested a lot last year in a air purification system, plasma air. It's the same air filtrations, it's purified air that hospitals use, that some airports, I know it's in Johns Hopkins Hospital, they have the same system that we've installed, that plasma air. And what that does is that purifies the air, that really pulls down any, not only viruses, but also bacteria, mold, and other things. So we have that purified air in all the classrooms. We have those touchless, we have the water fountains, we have the cleansers in every classroom. But it still won't stop the virus if somebody is either coughing or sneezing on you. That's why it's important, if they have symptoms like that, not to send them to school. And it's important to wear a mask so those things aren't being transmitted. But it comes down to, every doctor I talk to is washing your hands, not touching your face. If you're around people, wearing a mask, and just monitoring yourself to see if you're not feeling a little bit different, it's a lot of people get allergies. When we have allergy season, and if it's your allergies that you get every spring, or if it's something, if you start getting headaches, or if you start losing your sense of taste or smell, that doesn't happen with an allergy. So that's when you know you have something else other than just allergies. Because there's still colds out there, there's still the flu, there's still allergies, there's a lot of things, and a lot of people can get scared. And so you have to just monitor your symptoms. If it's, I get a lot of allergies, and I know the difference between allergies or if it's something different that I've never felt before. So I just encourage all of you to always talk to your children and make sure that we promote those basics of washing your hands, not touching your face, and protecting yourself when possible. When you're out, it always comes down to that. It always comes down to that. I don't know if any of you principals have anything else to add.
Not at this time, no, sir. Thank you.
I think you covered everything, sir. I can't think of anything for the high school students. Thank you.
Mm-hmm. And it can go, yeah, it's this Omicron is very contagious. We have felt it. We've had a lot of absences. We've had a lot of people get it. And thankfully, thank God that everybody so far has been able to fight it off. For the feedback I get from employees and from others is that it's a cold. Right now, I don't know if y'all know this as parents, but about our HR department told me that about 97%, 98% of our employees are vaccinated. So there's just a handful that are not for some reason or another. It's the way I see vaccines, without offending anybody, it's free medicine, and they've eradicated other disease, smallpox, polio. They've eradicated other disease, so it's actually a vaccine that they've been working on for about 10 years. If you really look into it, it's not something they just, it sounds like they developed, but they've been working on it for a long time. So anyway, it's just an extra layer of protection, and I think it's a good idea. But with that being said, it comes down, if it's your child, it comes down to you as a parent to make that decision. But if there's no other questions, I guess that'll do it. It's about 6:20. We're gonna go through 6:30. We have about another 10 minutes. Unless anybody has any questions, we'll wrap it up. Ms. Leos?
Yes, sir.
Oh, sorry. I wasn't sure if I'm talking to myself or anybody's helping.
No, I'm here. I'm here.
Do you want to talk about the GED classes? You want to mention that?
Yes. I sent out some information home to everyone today via email. We're starting GED classes in person. We have been having them virtual, where they're going to start with 2 days out of the week. Prior it used to be Monday through Thursdays. Now it's going to be Mondays and Wednesdays, 9 a.m. to 12 at the middle school. Reason being is normally we had them at the high school, but because we have over 10 students that are attending GED classes and the classroom's a little bit small, we want to just try to keep everyone safe. So we'll be using room 113 at the middle school since it's a larger classroom. So students can have more space. So we're inviting anyone who wants to take the GED classes. They are free. They're being offered by El Paso Community College. And everyone learns at their paces. So don't feel, some people feel intimidated. The instructor, Ms. Patiño, is amazing. She does really good work, and she works with you individually because everyone is learning at a different pace. And so there are classes that are being offered, and I hope people take advantage of them. So Next week, the 31st, we will start again Mondays and Wednesdays, 9 to 12 GED classes. We also have some other copies with principals coming up with all three. So you'll be receiving that information as well. We hope that you all can attend. Also, we have our presentation coming up February 17th by Texas Tech. The program is Pasos para Prevenir Cancer. And they're going to be doing a half-hour healthy meal planning. So anyone can log in at 5:30. It's going to be a virtual meeting presentation, and they'll be doing a healthy menu. And then we're going to be doing a half-hour of strength training. So something new. And then I've also invited the Justice Department to do a presentation on drug awareness. We had a presentation last night with our migrant families, and we got really, really good feedback. So I'm going to invite them back in for our district, any parent that wants to participate and take advantage of the information they're providing for us. And I think that's it for now.
I'd like to remind parents that tomorrow is a half day. Just remember that tomorrow's a half day for our students. And again, we added 2 more half days, April the 6th and April the 20th. And finally, I'll say, if there's any parents out there who they know somebody, it could be an older child or somebody that's in college or somebody else that would like to sub for us, the minimum requirements for them to have at least 12 hours. So above that, and they get paid accordingly if they have a college degree, or if they're certified, their sub rate goes up and up and up, depending on those factors. But we're looking for, and that's been the case here at Anthony. We have had some subs that have 30 hours, some that have 60, some that have 90, some that have college degrees, some that have master's degrees. But it's, I think it's a great opportunity. We pay very well, and if you'd like to sub, you can apply online. And I would encourage you, we have here subs, former students, people from the community, and of course, a lot of people from El Paso and other areas too that come in and sub. If you know somebody that lives in New Mexico, they can come sub over here as long as they have the right amount of hours in their transcript, college transcript. So I would encourage any of you to let them know. We also might have some tutoring positions too, but subs is what we're, all districts, not just us, but it's what we're looking for.
Okay.
Okay, well, it's 6:25, so we're almost at 6:30. I'm not sure if there's anything else. If not, I want to thank everybody for joining us. We'll do this again. I know the principals are having theirs in the next week or two, right, Melissa?
Yes, yes.
You'll put that on the website. And if you have a question tomorrow that you forgot to ask today, by all means, call us. Either call the principal or call us over here at central office, or Ms. Leos. Her email is real easy. It's MLEOS, mleos @anthonyisd.net. She's our parent liaison. She'll tell you everything that's going on related to parents, right?
Yes.
There's meetings, there's programs, there's so yeah, everything that's coming up. Please feel free to reach out to us. That's why we're here. We're here to, as Sandy says, to serve you. So everyone have a good evening and a good night, and we'll see you again soon whenever we do this again, maybe next month.
Okay. Have a good night.
And then the surge will be slowing down. Yeah.
Good night.
Okay. Good night.
Thank you. Good night.
Good night.